So let's practically look at how we can be able to diagnose and investigate lactose intolerance in the hospital. All right, and this will be looking at what a clinical scenario, and this clinical scenario is like asked in an exam hall. Okay, a long question, and anything that has to do with diagnosis, you most of the times the question will be so long that you get confused on the way. All right, but let's see how we can be able to follow up a diagnostic question for lactose intolerance. Right. So this is a question so long, right? So just be with me. They said that a 30-year-old Nigerian fresh student presented in a hospital in London with a history of what abdominal cramps. Now you start writing it out. All the symptoms you'll be writing it out. So symptom one is what abdominal cramps. Symptom two is what bloating. Symptom three is what diarrhea. Now what was the cause of all this? Or basically, what was the food that this person took that had to all this gastrointestinal? Because this gastrointestinal, you have to ask about the food. Do you understand? So maybe they asked the students that brought them to the hospital, and they said that the person actually took some dietary products. So you basically try to look at what medical condition will somebody will somebody take dietary products and it will lead to abdominal cramps, bloating. Do you understand? Now, the questions are this. You should list 3 investigations you would request from the laboratory for this patient, and you should state how each would aid you in making a diagnosis. All right. Now, what is the most likely diagnosis after receiving the investigations or tests you ordered from the laboratory? Now, 3, what are the 2 biochemical complications most likely in this patient? Okay, so let's move. Now you basically be looking at what electrolytes will be lost when there's diarrhea. Do you understand? If if this electrolyte is lost when there's diarrhea, what will the condition that will result, right? You do a lot of calculations, right? So you could say this condition is clearly what lactose intolerance. Okay, so you don't have the lactase enzyme. So when you take any dairy products like cheese, yogurt, do you understand? The enzymes to break down these products in the body are not there. So you're having problems like what? Diarrhea, vomiting, bloating, abdominal cramps like the lead said. Let's talk about a possible test for this. A possible test you actually want to order from the laboratory for this. So you might want to order for fasting blood sugar. So that this fasting blood sugar measures what? Glucose after you have not eaten for about what? 8 hours, right? So it is often the first test done to check for what? Pre-diabetes and diabetes, but might also be uh, applicable for diagnosing lactose intolerance. Okay, so let's move. The next one is what? The serum EUCR, and this is you trying to check the serum E. What is E? That's electrolytes. Then serum U, that's what? Urea, then creatinine. Okay, so now this test is to measure what? Electrolytes, urea, and creatinine levels in the body. Now a creatinine blood test measures the levels of creatinine in the blood. Creatinine is a waste product that forms when creatinine, which is found in your muscles, break down. Okay, so now this test will tell your doctor how well the kidneys are working too. All right, because you want to do some differential diagnosis to rule out. Do you understand? You want to rule out possible differential diagnosis, because if your kidneys are not working well, you might have accumulation of some waste products in your body systems and can lead to all these abdominal cramps and bloating too. Right? So this serum EUCR is mainly for differential diagnosis. All right. So just looking at some symptoms of what lactose intolerance, you might have what? Bloated stomach with excessive gas. You'll be feeling full. There will be lower abdominal pain. There will be nausea and vomiting. There will be diarrhea, and there will be what? Constipation. Okay. Then the next test you want to order for is what? The OGTT. That's oral glucose tolerance test. Okay, so oral glucose tolerance tests are done to measure how well your body can process large amounts of sugar, because lactose or glucose is a form of sugar. So you want to look at how the body can basically process sugar. Do you understand? So now, if the blood sugar reading is above a certain level, this could be a sign that sugar is not being absorbed fast enough by the body's organs. Okay, but if the blood sugar levels are low too, it could be that the enzymes needed to break down sugar are not there. Do you understand? So that was actually speaking on one side. There's the other side too. Then the hydrogen breath test. This hydrogen breath test is a simple and non-invasive way to diagnose common gastrointestinal conditions. And these common gastrointestinal conditions include what? Lactose intolerance and the SIBO. SIBO is what? Small intestine bacterial overgrowth. All right. So now, it does take some it does take advanced preparation to make sure results are accurate. The breath test evaluates your digestion of particular sugars by measuring the gas you exhale. Do you understand? That is usually exhaling hydrogen and methane. Okay, so hydrogen breath test, you basically trying to look at how glucose is being broken down in the body. All right, if it is being broken down properly, or if there are some presence of what, some bacteria in the small intestine. Right. So answering the big question now, what is the likely diagnosis? The likely diagnosis is, of course, what? Lactose intolerance. Okay. Now, what are the possible complications you might find in this patient? Uh, the possible complications you might find in these patients are what? Oh, I'm just kind of like going too fast. Possible complications is what? Metabolic acidosis. That's because the patient has diarrhea. So they are losing a lot of what? Fluid, nutrients through watery stool, and the bicarbonate ion is being reduced, all right? So you're having what? Acid buildup, right? So metabolic acidosis. Then you're having dehydration and hyperventilation, of course, all right? You are losing watery stool, you are losing water too. So you are becoming dehydrated, okay? And you have this problem of breathing too fast. Do you understand? Like insufficiency in breathing, right? So that's it about how we can be able to diagnose, investigate for lactose intolerance. So bye for now, guys.